You wake up in the morning, open your eyes, and the first thing you feel is that completely dry mouth, lips stuck together, tongue heavy. You walk to the kitchen, drink 2 glasses of water, and think, I didn't hydrate properly yesterday. And the day goes on. This happens again tomorrow, and the day after, and the following week. And you keep believing it's normal, that everyone wakes up like this, that it's just an age thing, that there's nothing to be done. I need to tell you something that nobody has explained to you clearly until now. Waking up with a dry mouth when it happens every single day is not normal. And after the age of 60, it deserves special attention because it can be the earliest sign of conditions that, discovered early, have treatment and have solutions, and discovered late, cause damage that cannot be undone. Over more than 15 years of caring for elderly patients in my practice, I learned to listen to the signals the body sends before it starts screaming. And a dry mouth every morning is one of those signals the body whispers, sometimes for years, before the problem shows up in lab results. I am Dr. Lina Laurent, geriatrician, specialist in quality of life for the elderly. And today, I'm going to show you the 6 most important causes of dry mouth in people over 60, from the simplest to the most serious. And what can you do with this information? Before getting into the causes, let me explain what saliva really is. Because most people believe saliva is just water in the mouth, and it is far from that. Saliva is a living, complex substance. It contains enzymes that begin digestion right in the mouth, minerals like calcium and phosphorus that protect tooth enamel, antibacterial substances that prevent infections, and proteins that lubricate the mucosa and facilitate speech and swallowing. When saliva fails, the entire body feels it. Teeth become more vulnerable to cavities, gums become inflamed more easily, swallowing becomes difficult. And in elderly people, difficulty swallowing is a real risk for choking and aspiration pneumonia, which is one of the leading causes of hospitalization and death in people over 75. And here is what specifically changes after 60. The salivary glands age along with the rest of the body. Saliva production is already naturally lower. When any additional factor interferes with this already reduced production, the impact is felt far more intensely than it would be in a 35-year-old. According to the World Health Organization, xerostomia, which is the medical term for dry mouth, affects between 20 and 30% of the general population. But in people over 65, that prevalence rises to more than 40%. And in elderly patients who take 5 or more medications per day, which is the reality for nearly half of Brazilians in that age group, the prevalence can reach 60%. 3 out of every 5 polymedicated elderly people have dry mouth, and most believe it is just a normal part of aging. Let's understand what is causing this. If this content is being useful to you, hit the like button now and subscribe to the channel. Every week, I bring information like this designed specifically for people age 60 and over, based on science and on the reality of clinical practice. Turn on the notification bell so you don't miss any video. The first cause is dehydration, but not the kind of dehydration you recognize. Most people hear the word dehydration and think of intense dry mouth, dizziness, dark urine. But there is a mild chronic dehydration that elderly people carry without realizing it. Because one of the things that changes most with aging is precisely the perception of thirst. After 60, the osmoreceptors in the hypothalamus, which are the brain structures responsible for detecting when the body needs water, progressively lose sensitivity. A young person begins to feel thirsty after losing about 1% of their body water volume. A 70-year-old can lose 3%, 4% without feeling any thirst at all. The result is a state of mild, permanent dehydration that the person does not feel, does not notice, and therefore does not correct. And waking up with a dry mouth is one of the few visible signs of this invisible state. A study published in the European Journal of Clinical Nutrition involving more than 800 Brazilian and Portuguese elderly people found that 65% of them showed some degree of chronic dehydration, and the majority had no subjective complaint of thirst. Dona Filomena, 73 years old, a housewife from Belo Horizonte, came to my practice complaining of intense dry mouth every morning, cracked lips, and difficulty swallowing her breakfast bread. She drank coffee, sweetened tea, a glass of juice, but almost no plain water throughout the day. When I asked how many glasses of water she drank, she thought for a long moment and said, 2, maybe. I don't feel much like drinking, doctor. Together, we implemented a simple protocol: 1 glass of water upon waking, 1 glass before each meal, and 1 glass before bed, not counting the rest of the day. Within 2 weeks, the dry mouth had improved by 70%. Simple as that. What to do? Don't wait for thirst to drink water. Thirst in the elderly is a late signal. By the time you feel it, you are already dehydrated. Set reminders on your phone. Use the marked water bottle strategy. Keep a visible glass in the places where you spend the most time. The goal is 1.5 to 2 liters per day. The second cause is sleep apnea, and this one surprises a lot of people. When the throat closes during sleep and breathing stops, the body automatically opens the mouth to try to compensate for the airflow. Spending hours with your mouth open while sleeping completely dries out the tongue, the mucous membranes, and the lips, and you wake up with that paper dry mouth. A study that followed more than 1,000 adults complaining of dry mouth upon waking found a revealing piece of data. While only 3% of people without nighttime breathing problems had a dry mouth on waking, among those with severe apnea, that number jumped to more than 31%, 10 times more frequent. And dry mouth was often the only sign the person noticed, because the apnea itself occurs during sleep, when the person is unaware of it. After 60, as I mentioned in the previous video, the throat muscles naturally lose tone. The prevalence of apnea in elderly people is over 50%, and the majority have no diagnosis. Mr. Dirtu, 71 years old, a retiree from Curitiba, came to my practice because of dry mouth. He didn't snore, or at least his wife didn't complain about it. But when I asked whether he woke up feeling tired even after 8 hours of sleep, whether he had morning headaches, whether he got up several times during the night to urinate, he answered yes to all three. I ordered a polysomnography. His apnea was moderate to severe, with more than 25 respiratory arrest episodes per hour. With appropriate treatment, in his case an intraoral device, the dry mouth disappeared within 2 weeks. He told me, "Doctor, I had no idea the dry mouth and the tiredness had the same cause." What to do? If you wake up with a dry mouth and also feel tired for no apparent reason, have morning headaches, or wake up several times during the night, talk to your doctor about investigating sleep apnea. The polysomnography exam is the gold standard for diagnosis. The third cause is diabetes, and here the geriatric perspective is fundamental. Type 2 diabetes is one of the most underdiagnosed diseases in elderly people, not because doctors don't order the test, but because the diagnostic criteria and classic symptoms often present differently in people over 60. Dry mouth is one of the first signs of diabetes, especially when accompanied by thirst that won't go away, frequent urination, and persistent fatigue. The mechanism is straightforward. When blood sugar is elevated, the kidneys try to eliminate that excess through urine. To do this, they need a lot of water, which they pull from the body itself. The body becomes dehydrated from within, the salivary glands produce less, and the mouth dries out. According to data from Vigitel 2024 from the Brazilian Ministry of Health, the prevalence of diabetes in the adult Brazilian population has reached nearly 13%. In people over 65, that prevalence exceeds 30%. 1 in every 3 elderly people has diabetes. And the Brazilian Diabetes Society estimates that nearly half of Brazilians with diabetes do not know they have the disease, because in the early stages, the symptoms are subtle, diffuse, and easy to attribute to age. Dona Conceição, 69 years old, a retired businesswoman from Fortaleza, came to my practice with intense dry mouth every morning and thirst that wouldn't go away throughout the day. She said she drank water as though she were in the desert, along with the fatigue she attributed to her age. It's natural, isn't it, doctor? At almost 70. I ordered routine tests. Her fasting blood glucose was 198. Normal is below 100. She had had diabetes for at least 2 years without knowing it. After starting treatment and controlling her blood sugar, the dry mouth gradually decreased. Within 3 months, she told me she was waking up with a normal mouth for the first time in a long time. What to do? If you have dry mouth upon waking and also feel excessive thirst during the day, wake up at night to urinate frequently, or have fatigue that won't go away, ask your doctor for a fasting blood glucose test and glycated hemoglobin. These are simple blood tests available through the public health system, and they can reveal a diabetes that has been going unnoticed. Tell me in the comments where you are watching from. Write the name of your city And also tell me, how long have you been waking up with a dry mouth? This exchange of experiences helps many people who are going through the same thing and feel like they are alone. The fourth cause is the effect of medications, and this is the most common cause in elderly people and the least investigated. The United States Department of Health has already documented more than 400 medications that list dry mouth as a side effect. 400. And many of these medications are extremely common among elderly Brazilians. Blood pressure medications, especially diuretics, which eliminate water from the body and reduce saliva production. Antidepressants, which act on the nervous system in ways that reduce salivary secretion. Antihistamines for allergies, which block receptors that also control saliva. Medications for overactive bladder, widely used by women over 60. Medications for anxiety and sleep. Medications for Parkinson's disease. And here lies the problem specific to the elderly. When a person takes one medication that on its own already causes mild dry mouth, the effect is tolerable. But when they take 3, 5 medications, each with that same potential, the effects add up. The mouth becomes permanently dry, the lips crack, swallowing becomes difficult, and the person believes it is just an age thing. It is not. It is the accumulated effect of medications that have never been reviewed together. Dona Aparecida, 74 years old, a housewife from São Paulo, came to my practice with a complaint she considered unimportant. Extremely dry mouth, difficulty swallowing even the breakfast bread roll, lips always cracked. When I looked at her medication list, I counted 6. One for hypertension, one diuretic, one antidepressant, one for allergies, one for joint pain, and one for sleep. All with the potential to cause dry mouth. Together, they were turning her mouth into a desert. I carried out a full pharmacological review with her doctor. We substituted 2 medications for alternatives with less salivary impact, adjusted the timing of others, and within 6 weeks, the situation had improved greatly. She did not need to stop any essential medication. She needed someone to look at the entire list all at once. What to do? Bring all your medications in a bag to your next appointment. Pills, vitamins, herbal supplements, everything. Ask your doctor directly. Could any of these be causing my dry mouth? Is there an alternative? That simple question can transform your quality of life. The fifth cause is Sjögren's syndrome, and this one is especially important for women. Sjögren's syndrome is an autoimmune disease in which the immune system attacks the very glands that produce moisture, primarily the salivary glands and the tear glands. The result is a mouth that burns, that hurts, where even simple foods become difficult to swallow, and eyes that itch, burn, and are constantly red. About 90% of patients with Sjögren's are women, and the diagnosis is most common between the ages of 45 and 65, exactly the postmenopausal period when the immune system is already undergoing significant changes. The biggest problem is the time it takes to reach a diagnosis. On average, a woman with Sjögren's waits 3 to 5 years between the onset of symptoms and the correct diagnosis. Why? Because the dry mouth becomes dehydration, the dry eyes become fatigue, the fatigue becomes stress, and the disease progresses while nobody names it. Dona Claudia, 62 years old, a retired teacher from Porto Alegre, was using eye drops constantly, drinking water nonstop, and her mouth never improved. She told me during a consultation, "Doctor, I drink 2 liters of water a day, but it feels like my body doesn't absorb any of it. My mouth dries out immediately." When we ran specific tests, blood antibodies, and salivary gland evaluation, the diagnosis was Sjögren's. She was referred to a rheumatologist, started appropriate treatment, and 2 years later told me, "I feel like myself again." What to do if you are a woman with dry mouth that doesn't improve with hydration, and you also frequently experience dry eyes, accompanied by fatigue and joint pain? Ask your doctor to investigate this condition. Early diagnosis makes all the difference. The sixth cause is chronic kidney disease. And as I mentioned in the first video on this channel, it is far more common in elderly people than most people imagine. When the kidneys lose their ability to filter properly, the toxins that should be eliminated accumulate in the blood. One of the consequences is that the body urinates more to try to compensate, losing water in the process. The salivary glands are affected, reducing saliva production, and many patients with kidney disease describe a metallic taste in the mouth along with the morning dryness. Exactly that. The presence of substances that should have been filtered by the kidneys reaching the saliva. If you have frequent dry mouth along with swelling in your legs and feet, foamy urine, high blood pressure that is difficult to control, or intense fatigue, it is essential to investigate kidney function. A simple blood test measuring creatinine and calculating the glomerular filtration rate already gives a good indication. And remember what I said in the kidney video? Creatinine alone can appear normal even when the kidney is functioning at only 50% capacity. Ask for the EGFR, the estimated glomerular filtration rate. That is the number that reveals the true picture. Now, I'm going to give you a practical plan for what to do with all of this. First, for 1 week, observe the pattern. Does the dry mouth happen every day? At what intensity? Do you have other symptoms alongside it? Excessive thirst, fatigue, dry eyes, snoring, waking up at night to urinate? Write everything down. That record will be invaluable at your medical appointment. Second, review your hydration habits. Don't wait for thirst. It arrives too late in the elderly. Drink a glass of water when you wake up, before each meal, and before bed. Use visual reminders and phone alarms. Third, bring all your medications to your doctor and ask about the salivary effect of each one. Don't make that decision on your own, but do ask the question. Fourth, request tests. Fasting blood glucose and glycated hemoglobin to investigate diabetes, creatinine and EGFR to assess the kidneys. If you are a woman with dry eyes and dry mouth, specific antibodies for Sjögren's. Fifth, if you snore, wake up tired, or have morning headaches, request an investigation for sleep apnea. Sixth, take care of your oral health with greater attention. Saliva normally protects teeth and gums. When it is lacking, the risk of cavities and infection increases greatly. Brushing at least twice a day with fluoride toothpaste, using dental floss, and visiting the dentist regularly are all even more important when dry mouth is present. Before closing, I want to tell you something I consider fundamental. The human body is extraordinary. It works nonstop to keep us healthy. And when something is not right, it begins to send signals. Subtle, discrete signals, easy to ignore. The dry mouth you are attributing to age may be your body trying to tell you a story. A story about your kidneys, about your blood sugar, about your sleep, about your medications, about a condition that doesn't yet have a name but does have treatment. The problem is not that the body doesn't speak. It's that nobody taught us to listen. Today you learned to listen a little better, and that is already an enormous step. Now I ask one thing of you. Do you know someone who wakes up with a dry mouth every day and thinks it's normal? A mother, a grandmother, a friend, a neighbor who always mentions it and has never looked into it? Share this video with that person right now. Send it on WhatsApp in the family group. The information you are sending may be exactly what that person needs to seek help, and that help can arrive before the problem gets worse. In the next video, I'm going to talk about the egg, a food that costs less than $1 and that science has shown to be a powerful ally for people with diabetes or borderline blood sugar. But there is a right way and a wrong way to eat it, and most people do it the wrong way. Subscribe to the channel and turn on the notification bell so you don't miss it. I am Dr. Lina Laurent, geriatrician. Pay attention to the signals your body sends. They are trying to help you. Wishing you great health and great quality of life. See you in the next video.